Welcome, welcome. Today we have with us Kimber Dower. She's the occupational therapist for Applegate Homecare and Hospice here in St. George, Utah. Today, the purpose of this video is to go over occupational therapy, what it is, and as well as who it's for. So thanks for being with us, Kimber.
Thanks, Tyler, for having me.
For sure. So we'll jump in right into the first question here. And it is, what is occupational therapy and how does it differ from physical therapy?
Okay. I get that asked a question a lot from patients and people around town. And so occupational therapy, I would say what we provide is based on a patient's occupation. That's why we use occupational therapy. We provide the therapy for those who, in this stage of their life, basically activities of daily living is what their focus is. It's what their occupation is. And so we look at that and we provide the different activities in relation to a lot of like daily activities, bathing, dressing. It can even be things like brushing their teeth, fine motor skills like buttoning. We look at a lot of different things such as safety in the home, what we can do as far as changing the home environment, adding grab bars to the bathroom, things to decrease fall risks. So there's a lot of things occupational therapy involves in the home. As far as physical therapy, the difference, both therapies, we look at a person as a whole. And so we do have some overlap. So a lot of times we'll look at balance, whatever the problem might be. And then we provide that, through different ways, balance, strength. But I would say some of the different things we do is more like the home safety, fine motor coordination, just really focus on the functional daily activities versus maybe like walking and balance that physical therapy would focus on.
Totally. What would you say is the main goal of occupational therapy?
So when we look at goals, we look at the main patient's main goal is really what we look at because we want our goals to be their goals. So in this instance, a lot of them it's just how we can get back to how they can get back to taking care of themselves, being independent, and not have someone do it for them, and to do it safely. I think that's the biggest thing is, can they do it safely in the home? And so,
yeah, perfect. The next one is, how do you determine which exercises or tasks are best for each patient?
Okay, so we usually assess the patient to determine, what's going on, where the problems lie. We break down, where they're having problems in the activity. Is it a strength issue? Is it a balance issue? Is it a fine motor coordination issue? Is it a cognition issue? Is it a vision issue? I mean, there's a lot of different things that are involved. And so it's hard to say specifically because everybody is so different, but we just have to figure out where the problem lies. And then that's what we address to get them back to being able to function independently.
That's really cool, actually. Yeah, that's very cool.
It's fun.
What types of interventions do you offer for elderly patients dealing with age-related challenges?
So a lot of the main age-related challenges we see are like decreased vision. We see a lot of low vision stuff. So we'll provide different things like different lighting. So we'll maybe increase the lighting in their house. We might, look at magnifying glasses. We will also use raised dots. So if they can't tell where their laundry, to turn on the laundry, to turn on the dryer, we put a little raised dot there so that they know where to, what to push. And then same with microwave, like the start, so they can, and then they just have a lot of different adaptive, equipment out there so that you can improve their function. So low vision, cognition is another age-related one that we see. We do a lot of caregiver training too for patients who have cognition and how to deal with that. And then also teaching them ways to better, write down things so they don't forget it, put it in, use their phone like as an alarm to remind them to take their medication. So there's a lot of different tools and ways to be more independent, even though they're, getting some short-term memory loss. And like I utilize a lot of, our cell phones and things like that for
That's really cool. So you mentioned raised dots, like,
Yeah.
I imagine, is that just like a red sticker or something like that? You put
Yeah,
on
so
things,
like
or-
little stickers, you can buy them. They have different, like some will be round, some will be square, some will be little pointy, so you can tell a difference between the dots. And so they have a lot of stuff like that.
Huh.
So
Well,
yeah,
that's cool. I didn't know that existed. That's
Yeah.
really cool.
yeah, and they have a lot of like medication stuff too that you can, like medication boxes that are time released, so you can set them up and they're automatic.
Oh, no way. So, like,
for
like
somebody, so it spins and it automatically will open at the time they're due. And so someone who will, is forgetful or just needs a little bit more monitoring as far as their medication goes, then they have a lot of that type of thing. So we do a lot of adaptive devices like that. So
That's really cool. Okay. And what role does occupational therapy play in helping patients recover from major surgeries like joint replacements?
So I'd love to, my biggest goal with these patients, and I think most of them are this, it's what they want, is just making sure that they go into a safe home, a safe environment. And so we try to keep them from falling. And so a lot of my orthopedic patients will go in and do home safety evals, make recommendations for grab bars, make recommendations for raised toilet seats. A lot of times I'll ask them to use like a bath chair or something so that when they're, their balance is going to be off a little bit. So shower's the number one place where people fall. So so we just try to like lessen their how do you say that? We try to decrease their fall risk, basically, is what we're doing. So yeah.
That's really cool.
Yeah.
What are common activities or skills that occupational therapy helps patients improve?
Yeah, that's a good question. There's a lot, and like as we talk,
Totally.
like, there's just so much. Like I think occupational therapy there is a lot of. I'll do like a lot of patients. If I have a patient who's had a stroke, then we'll work on like a fine motor coordination, and so we'll use like playing cards, or we'll use different types of activities to increase that use of their fine motor coordination. Well, I like to use money, working on turning over like coins. We do use things called like TheraPutty, which is like a resistive putty that they can work on hand strength and find things. A lot of people love to be able to find things in the putty. And then sometimes we use TheraBand to do strengthening. That's some of the tools we use, but
That's cool. So like TheraBand, like that's like the elastic band?
Yeah, it's like elastic band, to work on strengthening. Because muscle strength is so important, even especially as our patients get older. And so I try to get them on most of them on a home exercise program, so they're at least doing that twice, every other day, or at least doing some strengthening, because a lot of people don't. So
No, that's fair.
it's kind of one of the things I like to do.
That's sweet.
So yeah.
And then the last question we have is, how do you involve families or caregivers in the therapy process?
The biggest way we involve our caregivers is by having them involved in the sessions, talking to them about what they can do, how they can motivate their loved one, or whoever they are, and just education. Like, it's a big time education, especially if the patient has dementia and it's a loved one, explaining how dementia works, what level they are in, and how they can best work with that patient to get the best from them as far as
Totally. Yeah, just being able to train the family member so they can
just
help
give
take
them
care of them.
education so that they can help follow through, because we're short term. And so it's a big part of our job is to educate the caregivers so that they can help with that independence and doing that, keep the patient as independent as possible, and not turn, and not make that patient dependent, because sometimes if they do everything for them, then they do become dependent. And so educating them on helping them to know how to create an independence, that I think is an important thing for the caregiver to know.
Totally. And I guess I'll sneak in one last question here.
Let's do.
Is just, you mentioned there like that occupational therapists, they're short term. What is the typical term?
So, oh my gosh, not so depends on the patient. It can be anywhere from 3 weeks to 2 months. Sometimes, just depending on the severity of, let's say, if it's a severe stroke and they're going to be homebound for a lot longer. A lot of our orthopedic patients are going to be more like 2 to 3 weeks. And so it really just depends on the patient, but we're not long term as far as like more than 4 months, I would say. But it just really depends on the patient and what they need.
Yeah.
And that's what we provide them. So
that's really cool.
yeah.
Well, sweet. Thanks, Kimber.
Yeah.
For your time.
Tyler.